Okay, so I want to show you also another video. There might be some parts that actually repeat, but it's some myths and truths about MRSA, and I think it's a good tool to just watch and see what some people probably, frequently ask questions that other people have proposed, and I'm sure this video can answer for you.
It's time to get the truth about MRSA. Here is what you need to know about the superbug.
We've heard all this talk about this new superbug, MRSA. So what exactly is it?
MRSA stands for methicillin-resistant Staphylococcus aureus. Basically, it's a type of skin infection that usually starts out in an area of injured skin and can look like a boil, pimple, or even a spider bite. The infection rapidly becomes worse, and it can be very tender, painful, and warm.
MRSA is something new, right?
The truth is, MRSA has been around for years, but it was generally only found in ill people in the hospital setting. And now it's gotten a little stronger. It's moved out into the community and the general population. It is what we call community-associated MRSA.
From the sounds of it, MRSA is a superbug. So is it really a threat?
The truth is, although it does happen on occasion, it is still rare that staph skin infections become life-threatening in a healthy person. Once diagnosed, effective treatments are available.
So is it true that people with MRSA are a threat to everyone around them?
The truth is, many people have staph bacteria on their skin normally and have no ill effects. While these people may pass the bacteria on to others, simple self-care measures can help prevent the spread of MRSA infection in yourself and keep you from spreading it to others.
I've heard MRSA can't be treated with antibiotics. Is that just a myth too?
The truth is, MRSA is resistant to certain antibiotics, but most infections can be treated with proper alternative antibiotics, and if necessary, your doctor may drain and clean the infected area. Although it is called a superbug, there is no need to panic. MRSA can be treated effectively. However, we do need to be cautious and protect ourselves, so everyone should be taking these easy steps to minimize the potential effects of MRSA. Keep your personal items personal. Don't share anything that comes into close contact with your skin, like towels or sports equipment. Keep any wound clean and covered. This will limit exposure and transmission. Always maintain good hand washing habits. Practicing good hygiene is always a good idea. To get more information on MRSA or to find out the truth about other health concerns you have, go to visualdxhealth.com, a trusted source for today's health information. This educational video was brought to you.
Okay, and that's actually a really good segue to some of the stuff that we're going to discuss, because we're going to discuss the prevention of Staph aureus infections. And I think overall, hopefully you're getting a good understanding of what Staph aureus is, how it kind of works, and now, when you talk to other people about it, you'll know more than just what you know for the exam. So, prevention of Staph aureus infections. So according to the Mayo Clinic, there are some common steps that you can take to prevent community-acquired infection. So as the video was saying, washing your hands regularly. Very important, because you can spread it to somebody else. You could even spread it to yourself. If you have it on your hand and you touch a wound, you can spread it like that. If you have a wound, make sure that it's covered. Even if it's just a simple cut, simple abrasion, cover it up. Band-aid with a wrap, whatever works to keep it covered. And then another important thing is to avoid sharing personal items like they were describing, like towels, even razors, and personal items like your exercise equipment. You don't want to share with other people, because you don't know if they bled, if they had other things on there, how often they wash it. It's just something that you want to stay away from as normal precautionary measures. Keep sanitary. That's very important with if you have a cut and let's say it gets on your linens or on your towels. Make sure to wash your linens, your towels, and things regularly, because that's very important to not spread it. And then after extensive exercise, if you're playing a sport or whatever, make sure to wash up, and practicing good hygiene will go a long way in preventing community-acquired Staph aureus infection. Now, the Mayo Clinic also had some common steps for preventing hospital-acquired infection, and this one seems to be the killer, or the one that causes more problems. So, isolating patients diagnosed as MRSA positive, that's very important because it kind of gives a hint that if a person is going to go in there, that they know, also healthcare professionals, that if they need to put on special linens or special suit or whatever they use, they gown up with or whatever, they know that they have to take very careful measures to make sure they don't spread it outside of that room. And then another one is healthcare workers absolutely need to wash their hands thoroughly and wear specific garments to prevent spread. So that's very important because as a healthcare professional is taking care of, caring for a patient, if they are positive for MRSA or any disease for that matter, you want to make sure that that the healthcare professional washes their hands so they don't spread it from one patient to the other. Like we were discussing earlier, a problem with the numbers being so high is that some healthcare professionals are not taking that responsibility. And then again, properly disinfecting affected laundry and garments. So if a patient was in the hospital and they were positive for MRSA, that the maintenance, that the healthcare professionals, that they all work together, collaborate, with information and all that, and make sure that they take care of all the sanitary measures to make sure that it doesn't spread. And again, hygiene goes a long way. Okay, now the pharmacist's role in MRSA. This is something that you might not be as interested, but for my presentation at school in infectious diseases, it's important because we're pharmacy students and we want to see where is our role in all of this. So there was an article that I came across in Pharmacy Purchasing and Products that describes the role of pharmacists in MRSA, and it's extremely important. So one thing is actively working with infectious disease practitioners to establish optimal therapeutic vancomycin doses. So with MRSA, since we're not using penicillin derivatives, using vancomycin, we can help with establishing what dose works. So that is what our specialty is, and collaborating with other healthcare professionals, practitioners in infectious diseases. It's very important that we work together to figure out what our optimal therapeutic vancomycin dose is. Another thing we can work on is monitoring drug levels. That is something that we can look at the trough, we can look at the drug level in the person's, in the patient's body to make sure that they are where they need to be, to make sure that they're not underdosed or overdosed. Another thing is adjusting inappropriate doses. I mean, it happens when a doctor just doses it wrong for the patient, and that's where we step in to make sure that we inform the doctor that they need to change the dose of the antibiotic. Another part is proactively being a part of choosing an alternative medication choice when vancomycin is not sufficient. Again, that is the part where the pharmacist uses his expertise to give the doctor an alternate medication. I mean, if the person is, for some reason, cannot use vancomycin because it's contraindicated or any other, they've had past adverse reactions to it that they can't tolerate, that's where we step in to give different options for the doctor. And the pharmacist's role is extremely important in making sure that these patients are taken care of, because like we have been discussing and like the videos have been saying and showing, the MRSA is an extremely dangerous bacteria, and together we can definitely make a difference. Okay, so now I was showing you the video about myths and facts about MRSA, and also showing you the video about that healthcare professional discussing MRSA and its prevalence. It pretty much was the bulk and everything that I had to show you and explain to you about MRSA. So I hope it was helpful to you for your exam, and hopefully I explained it well enough to be able to do this again for my presentation. What questions do you have for me, if you have any?
Yeah, I have a question. How did Staph aureus become resistant to methicillin?
So that's a very good question. It's a common one too. So what happens is one explanation could be so a patient will get an antibiotic regimen. So let's say they'll be on penicillin for 10 days, but they'll stop taking it after, like, let's say 5 days. So the whole bacteria is not eradicated. It's not, rid of in the body. So some of it will survive, and this process of surviving can also cause the bacteria to learn, in a sense, and become resistant to the bacteria. Another phenomenon is actually that bacteria can share information with each other, so that way the bacteria can get it from another bacteria, and then you have this resistance propagating, with other bacteria. Another thing that can happen is just a spontaneous mutation for one bacteria. So, for instance, Staph aureus is common in your flora. So, if a spontaneous mutation occurs where one of the bacterium has a gene that's resistant to penicillin, it can also pass it on to one of the other bacteria and share information. But again, that's a spontaneous mutation, and most likely it has to do with giving antibiotics more than just a spontaneous mutation. But it's still possible that it could happen that way.
So, how worried should I be that something like this could happen to me?
Well, as we were watching the videos and as we've been discussing, I mean, it can happen to a healthy person, and that's where this is becoming a huge thing. Before, in fact, these type of infections we were more worried about with compromised people or neonates, or just people in very vulnerable situations. But when you have healthy people getting MRSA infections, it's very serious. So what you can do is do what we were discussing. So cover your cuts if you have a cut. If you do certain exercises or play certain sports, don't share your stuff with other people. The more sanitary, the better. Wash your hands as much as you can. Try not to touch open wounds or open cuts, or even with other people. Just the more sanitary, the better. It could only help you. So you or I could become infected by this bacterium. So it's a very serious thing that we need to keep an eye out for.
My last question is, you were talking about the role of the pharmacist, and you said something about inappropriate doses. Why would a pharmacist need to adjust an inappropriate dose, and why would something like that occur?
So, unintentionally, sometimes a physician can write an order for an antibiotic that's not appropriate. So the whole idea of evidence-based medicine is they found that a regimen works to get rid of, let's say, a bacteria. So being on, again, like we were discussing, penicillin for 10 days worked, whereas for 5 days it probably didn't work and the infection came back. So following these regimens are very important. So if a physician writes an order for a drug, where the time is not right, where it's too strong or not strong enough, depending on weight, because for children it's a certain, it's a certain milligram of an antibiotic per kilogram of weight. So if it's inappropriate, if it's too much, there can be a lot of adverse reactions. If it's too little, the bacteria will not be eradicated from the body. And this is where the pharmacist has the role to step in and discuss with the doctor that it's not optimal therapy. Another role for the pharmacist is to be part of looking at new literature, because there will be antibiotics that will be specific for even maybe at a shorter duration for specific bacteria, and this is where their expertise is very important. Pharmacists used to be thought of as just people who count, professionals who count pills, but now you see them more in the healthcare field in hospitals, collaborating with doctors at rounds and in other ways. So they're not just in the basement of the hospital. They're doing a lot more. They're being part of P&T committees and other committees like that. So as the span of the pharmacist's role is growing, it really shows the importance and significance that the pharmacist has within the healthcare field.